Analysis upload 10/7/2013 in NURB 461. The analysis I chose was Euthanasia with Advanced Dementia. Everyone wants to be a productive contributor to society. When people feel that their existence is no longer meaningful, should they be allowed to end their life? What would it feel like to no longer recognize your family, your friends, or to be able to care for yourself as you always have? That is what a day in the life of someone with advanced dementia is like. Dementia is a decline in a person's mental ability that is severe enough to interfere with daily life. The number of people suffering from this horrible disease is increasing considerably in the world today. Where I currently work, a substantial amount of our residents suffer from dementia and Alzheimer's disease. I watch daily as many struggle with everyday functioning, while other residents are no longer able to function at all. Family members are no longer recognized, while residents forget how to swallow, how to eat, they lose weight, become incontinent, have problems with communication, loss of mobility. Dementia robs people of their dignity and forces them to become dependent on others. During the later stages of dementia, many people will become increasingly feeble due to the advancement of their illness. They will also steadily become dependent on others for all of their care. Knowing what to expect can help everyone to prepare. It can allow the person with dementia to decide about the kind of treatment they care they might want, and allow them to write an informed advanced decision before they reach this stage, so they can have input on how they are cared for. It also helps caregivers and family members to think about these aspects as well. In many other countries, such as the Netherlands and Belgium, many people with early stages of dementia are signing advanced euthanasia agreements to allow medical professionals and family members to end their life when advanced dementia sets in. The elderly often associate dignity with autonomy, independence, and preserving one's intellectual powers. Some especially believe that the fear of losing one's intellectual capacity and the risk of being handed over to the will of others when one becomes incompetent are notable reasons for wanting to be euthanized in a timely way. A growing number of elderly do not wish to become a burden on their relatives. They do not want to be reduced to people who are simply the object of another person's responsibility. For many elderly ones, the dread of becoming a burden to their relatives is far greater than the fear of death. Financial matters do not represent the only aspect of burden. Rather, older persons mainly fear that their relatives will have to pay a high emotional price when caring for them. In one article that I researched about this topic, authors examined the ethical issues that arise when a person wishes to sign an advanced euthanasia directive to avoid the loss of autonomy with dementia. Many questions raised with this article were about the responsibility of caregivers to know when the time for end of life has arrived. What if the person had signed the agreement in haste? When the person is in the advanced stages of dementia, people are not in an adequate state of mental capacity to change their mind. Should it be the responsibility of caregivers and loved ones to make this decision? Despite the fact that they have made previous arrangements for the end-of-life care, how can that responsibility be put on someone they care about? The authors of this article speak eloquently of what quality of life means, stating that the dignity of a person is based that all people belong to human society and all can relate to people suffering with dementia. Thus, even those with dementia deserve respect. How does this differ from standard advanced directives? Advanced directives that are drafted about end-of-life care permit the elderly to discuss decisions about their place of death, their physiological and spiritual care, and their medical treatment. Also, this type of advance directive can give the older person comfort or reassurance, allowing them to remain in control of their end-of-life health care, even after they have become incapacitated. This way, the wishes and interests of the once competent patient are fully respected. Advance directives allow people to die with dignity. With euthanasia directives, the patients sign their agreements when mentally capable, and then doctors or family members decide when it is the time to end their life due to the fact that the patient is no longer able to decide. With euthanasia directives, the patients do not have life-saving measures to keep them alive as in advance directives, but someone actually ends their life for them. As nurses, we face death on a regular basis. It is our responsibility as patient advocates help our patients die with peace and dignity. It is hard for many of us as nurses to change our frame of thinking from helping keeping our patients alive, but to help them die. Our nursing care continues, but with a change in focus. As healthcare providers, we need to accept death as a part of life and try to understand the moral and religious obligations that shape their own beliefs toward life and death. Nurses, especially those working with patients with terminal conditions, need to face the challenges of helping the dying control their own death. Often we know that the time of death is approaching and should do our very best to educate our families and to assist our patients with comfort at the end of life care. With that said, I can't imagine actually taking that person's life. That is a much different approach than just helping them remain comfortable and dying gracefully. I understand that there is a gray area that nurses and physicians play around with often. When we have terminal patients on morphine drips without vital sign perimeters, knowing that the very next dose may take the person's life. This is done frequently in hospitals and hospice settings and is not looked at as euthanasia. Is this much different? These are issues that each of us as healthcare providers need to address for ourselves and determine how we personally feel. Our own feelings very well may affect our care for our patients. Ethical issues such as this arrive in healthcare frequently and need to be dealt with appropriately to ensure that our patients receive the very best care that we can provide.